plans for the introduction of drug consumption rooms appear to have taken a step forward today. It comes after the Lord Advocate Dorothy Bain said it would not be in the public interest to prosecute drug users at such facilities. Campaigners have welcomed the development, arguing they provide a safe space for addicts and act as a vital harm reduction measure. But those opposed to the idea say they present their own risks. To discuss the issue, we're joined by Peter Krykant, an activist who used to run his own unofficial drug consumption room, and the Scottish Conservatives health spokesperson Sandesh Gulhane. Well, thank you both for joining us this evening. So, Peter, what does today mean to you?
I think it's a very emotional day for me today. I obviously went out and started an unsanctioned consumption facility here in Glasgow city centre. I personally witnessed how these facilities can save people's lives. We reversed 9 overdoses for 8 people. So that's 8 people that could be dead today. But I've also visited these facilities in 4 other countries, and they now exist in 17 countries around the world. So, a very emotional day. I can't wait to see the doors opening, and for people who are marginalised and pushed into the margins of society, often injecting drugs in really terrible conditions in alleyways, rat-infested alleyways, being offered some support and help where they desperately need it.
Sandesh, you're a GP, you'll have worked with people with drug issues before. Is this the solution to Scotland's drugs crisis?
I don't think we can say it's the solution. There's a lot of things that need to be done. But look, since we got into Parliament, I have said that I would back a trial because we need to see data, we need to see what will happen. But there's a lot of things to consider here. We need to consider where the consumption rooms will be placed. We need to think about what would happen to the addicts. Do they travel into the centres and to the areas? And then possibly most importantly, we need to look and say, well, what other help can we give to these people? What can we put in around it? What follow-through do we give? And can we give them some help to maybe come off the drugs, which is what the Right to Recovery Bill would allow, and that's something that we need backing for.
Peter, what would you say to that?
I mean, of course, these types of facilities offer that support that is not available at the moment. What I'd like to see is people being asked the questions around their health and their welfare when they visit these types of facilities. What support can we offer? Because people are often coming out of, situations of violence. That people have been surviving trauma. I don't think that we should necessarily be pushing people in this recovery agenda that has led to many of the problems that we now experience, not just in Scotland but throughout the UK. If we look back to 2008, the SNP-led government's strategy, the Road to Recovery, followed very quickly by the Tory Lib Dem coalition strategy in 2010, which also focused primarily on recovery, defining recovery as a drug-free life. For many people, they're neither ready or have the willingness to move off of drugs altogether. We need to offer people a safer supply. Really dangerous drugs are now entering into the market in the UK. We've started to see these synthetic opioids, which have caused devastation across North America. We need to offer people things like diamorphine or heroin-assisted treatment widespread. These have been the solutions in other countries that have had really high drug death rates. We're not talking about stuff that's radical. Switzerland opened its first consumption facility in 1986, followed very quickly by widespread diamorphine-assisted treatment. They now have more or less eradicated HIV transmissions, hepatitis C transmissions, and drug deaths are really rare in that country.
So I put it back to you, Sandesh, when you hear that.
Well, we need to have dual purpose. We need to help people, but we also need to make sure that those who want to come off drugs, and look, people come to me in GP, and normally something's happened. Normally someone's been injured or they've had a very close shave, and they come to me and say, I need help. And reading your own story, Peter, you need to get that help quickly when you need that help, because reading your own story, you didn't get that, and you can't get that here in Scotland. So you were lucky and fortunate enough to go to England, but lots of my patients can't do that. Lots of my patients then go back onto the drugs, they go back onto alcohol. But if we had the Right to Recovery Bill, that would allow people the right to actually get their treatment.
But what about those people that Peter's talking about who just aren't going down that road yet? They're still taking drugs, and is it not the idea that they, at least if they're going to do it and will persist doing it, they can do it safely?
Well, so I've backed a pilot into the right into getting consumption rooms. It's really important we get the data here. But look, from what you've seen from the Lord Advocate, this is something the SNP could have done quite a while ago. This is not a grievance with Westminster that they've been trying to portray. This is something they could have done. So my question is, when will they do it?
And what do you want to see now then, Peter, given that today is such an important day to you?
Well, I don't want to see a single consumption facility. I understand data, you know, we need to see evidence, but we've got the evidence. You know, these facilities, as just mentioned, have existed for over 3 decades in some countries. They're now in 17 countries around the world. I visited them in Australia, Portugal, Spain, and just recently, last week, in Copenhagen and Denmark. You know, the evidence is there. They work, they keep people alive, they support people to access the much needed health services. What we can't do is continue to focus on a singular route. I agree with Sandesh. You know, if people are seeking abstinence and that's what the route that they want to go down, of course they should be supported in that. But the majority of people that I've seen over the years who have been pushed into those abstinence-based recovery movements have eventually struggled with that, and many of them die because of lack of tolerance and because the desire is not there to stop taking drugs in the first place.
And Sandesh, is there any way that the Scottish Conservatives would be persuaded that this is the way to go?
We need to see data. And so, yes, there is data. There's data from around the world.
From 17
but
countries now.
We need to look at Scotland in particular. We are unique across the United Kingdom, you know, where the laws are the same. So what I'm saying is, let's get some data. That I don't see an issue with having pilots and looking, but it's important that we firstly decide what it is we're trying to achieve. We then find out what measure we're going to take, and then we actually go ahead and do that and then report back. Once we get those measurements, once we get that data, then we can look at it and then we can say whether this is a good thing or not for Scotland.
I've got to say though, John, the data's there already. You know, for the small amount of hours that I ran a site in Glasgow, Dr. Gillian Shorter from Queen's Belfast University, Professor Alex Stevens from the University of Kent evaluated the model, 894 injections, 9 overdoses reversed on a very small amount of hours, a few days a week. The data's there from 17 countries around the world. I visited Copenhagen last week. They have multiple sites. You know, people don't actually just have access to injecting drugs. They can inhale drugs. They have drug checking services. They have access to diamorphine.
Okay, just very finally, I appreciate the point you make. Just very finally, Peter saying the data is there. Very briefly.
Scotland is a unique place. It doesn't necessarily translate. Data doesn't translate across the world. Okay. We need to know what Scotland's saying, but also it's not just medical. We also need to get help with social work and other things like that.
Leave it there. Sandesh, Peter, thank you both for joining us in Scotland tonight. Thank you.